Hi, everybody. Jacob Brindle with Heart of Texas Physical Therapy. I'm the owner of HOTPT, as a lot of people like to call us. I just wanted to cover a couple of hot button topics that I field questions from patients pretty much all day, every day concerning physical therapy in general and what do we do. And the first one is why should I come see you at HOTPT versus a PT in my physician's practice? Well, there's a few differences there, and the biggest one is reputation. In private practice, and my business's ability to succeed is completely results driven, quality driven. If I don't have a good reputation in the community, if I don't get results quickly, then my reputation fails and my business fails. So at Hot PT, we are completely focused on quality and evidence-based practice as well. If you go to a physician-owned physical therapy practice, the physical therapists in that practice, they don't necessarily have to worry about where their next patient is coming from, because the physicians are always going to be writing those prescriptions and referrals to go see their physical therapist. So reputation is everything in private practice physical therapy. Another question I get all the time from patients is, do I have the right to choose which physical therapist that I see? And the answer to that is simple again. You, as the patient, have the ultimate and absolute right to choose your healthcare professionals and who you go see. So if you tell your physician you want to come see Dr. Brindle at Hot PT for your neck problem, your back problem, your dizziness problem, vertigo, balance, difficulty walking, all of these different problems that people suffer from every single day, then you have the absolute right to request to come see me. And it's actually very easy as well. All you have to do is just ask your physician to send that referral to 1-800-862-5429, and we'll get the ball rolling as soon as we get that referral. Another question I get from folks is, can I come directly to you and not have to go to my physician for that referral? And the answer is kind of complicated for this one. The other ones are simple. This one's complicated. So if we didn't live in the state of Texas, then yes, there would be direct access and you could come directly to me and not have to go through your physician. But in the state of Texas, we still require a referral from your physician to come to PT. I can evaluate you. In other words, you can come in and see me and I can evaluate you. But if I want to treat you, we need that referral from your physician. So it's always a good idea to go see your physician first. Anyway, just to make them feel more comfortable about their decision to send you to me as well. So in states where we're seeing that direct access, though, we're seeing that it saves the patient a lot of money and time, because sometimes you can't get in to see your physician quickly as sometimes you need. So we see a lot of people going to the emergency room, things like that. But we're also seeing it saving the industry and insurance companies a heck of a lot of money. Because when you go see your physician, obviously you've got co-pays and co-insurances and deductibles, and you're seeing a lot of times x-rays and MRIs and blood work and things like that will be ordered as well. And that costs insurance a lot of money. And it costs you, the patient, a lot of money too, as we're seeing with healthcare changing. But in states where people are going to their physical therapist first, we're seeing a massive change. We're seeing massive reductions in how much money has actually been utilized from insurance companies. There's actually a huge grassroots movement sweeping the country and also parts of the world as well. It's called Get PT First, or on social media, you see hashtag Get PT First. It's blowing up the internet. And again, this goes back to that grassroots movement of people realizing if they see their physical therapist first, it saves everybody a lot of time and money. And a lot of times, too, these conditions don't necessarily need to be seen by your physician because they do operate at a different level than we do. If it's a dangerous condition, trust me, your physical therapist will recognize it and we will send you to your physician. Other services that we offer here at Hot PT, besides treating conditions and problems that need physical therapy and rehab, we also offer people continuing care, and also anybody else who needs fitness consulting or health and wellness consulting. In other words, if you don't feel comfortable seeing a personal trainer who may not have the education or may not have the training to properly and safely supervise your exercise, You know, I'm specifically pointing at population over the age of 45 or 55 who have other health problems, and it may not be safe for you to exercise in a gym where there's not a licensed clinician supervising your fitness. We also offer that to patients after we see them for therapy, and even if you don't come to see us for therapy, give us a call. Our number is 254-981-3238 if you want to talk about those things. If you're not ready to come to physical therapy, we offer free assessments where you can come in and sit down with us. You can sit down with me, and we can talk about your condition, your situation, and if PT is a good fit for you. If you feel like you want to try some things on your own, if you scroll down on the website, we have several guides available with more than a dozen free tips and strategies that we give to our patients every day. We use them and they actually do work because I actually wrote those guides, and I found that they actually do work and they help people to make progress pretty quickly on their own. So if you don't feel like you're ready to come to PT, download them. They're free. Give them a whirl. See how they do for you. And if you need to, give us a call or come in and see us. We'd be happy to address any situation that you may have. Again, our number is 254-981-3238. I'd love to hear from you. Thanks for watching this video.